There's been a lot of progress in patient safety over the last 10 years. If we go back 10 years, we weren't talking about patient safety particularly. There wasn't a lot of national recognition of some of the harm that people were experiencing when they were coming into contact with healthcare. And that led to an emphasis on how do we address and reduce some of the main areas of harm that people were experiencing. And that was really important, and the sorts of approaches people were using were interventions that were designed to specifically address particular areas of harm, such as infections, pressure ulcers, falls, and so on. And we saw improvement, and that's been really good. But the kind of problem we have now is how do we continue to make care safer when we perhaps haven't got the same big obvious problems, but actually there are kind of many different problems that people encounter when they're delivering or receiving care. I think there's two things that need to be different. The first is we need to think differently about what we're measuring when we're talking about patient safety. So if you think about what we've been doing over the last 10 years, we've been measuring how harmful care is. So we know how harmful care was, last week, last month, last year, depending on the particular data we look at. But what we don't really know is how safe is care today. And we don't really have measures of safety, we have measures of harm. The second thing that needs to be different is that as we start to think about improving safety rather than reducing harms, we need to use a different set of approaches. The sorts of things that need to be put in place by teams in wards, departments, clinics and so on is for those teams to first of all have a very clear understanding of the processes of care that need to be in place to deliver safe care. They need to understand sort of what are the parameters of safety. So when might things start to be going wrong? Do they have a clear idea of what some of the triggers, what some of the hazards might be that would signal that care was potentially becoming unsafe, so that they start to anticipate those and spot them early and start to respond to them. Teams also need to have a sort of shared understanding of how they respond to things going wrong. So what actions do they then take if problems arise? And that needs to be clearly understood by everybody in the team. We often know that sometimes when things start to go wrong, people are uncertain about how to respond to them. And these approaches that are much more focused on anticipating problems, it can sound a bit negative to be thinking about this kind of where would things go wrong, what do we need to be doing. But actually what we know about industries that are very safe is they have this preoccupation with failure. They are always thinking about where the risks could arise. And sometimes that might be a bit counterintuitive in healthcare, where people are always working really hard to kind of keep care going and keep services being provided. But really, to get to a next level of safety, there has to be a shift in thinking. There's a few things the Health Foundation is doing to improve approaches to patient safety. So one of them is we are very interested in how can we support provider organisations, clinical teams and so on to start to monitor and assess safety rather than just measuring harm. And we've been working with Charles Vincent and his team in Imperial to develop an approach, a framework for measuring safety. The second thing we're doing is then developing approaches that people can use to make improvements. So we want people to have ways of assessing and monitoring how safe care is, but we also want ways of people improving that safety. So there's a number of tools and techniques that we're developing with teams in healthcare that will help them understand their systems of care, understand where things could go wrong, start to identify where the greatest risks are, and then what needs to be put in place to try and mitigate those risks. And so we're testing these approaches with 8 sites across the UK as part of our Safe Clinical Systems programme, and that will start to develop tools and approaches that we hope others can take on board. The third thing the Health Foundation's doing is that we've developed a resource centre for people who want to improve safety. The resource centre will bring together evidence, it will bring together case studies and tools and stories of people who have made improvements.